So why do we prioritise? Well, it enables us to be able to provide the safest level of care to that individual person who needs that caesarean birth. So there are different categories of caesarean birth. Category 1 are your Holby City emergency moments. That baby needs to be born within half an hour. Examples of needing a Category 1 caesarean birth include a cord prolapse, fetal bradycardia, that's where the baby's heart rate drops, a placental abruption, a uterine rupture. There is a very strict time limit on getting that baby out safely. And Category 1s are what we call acute hypoxia. There is a high chance that that baby is not getting enough oxygen through that placenta, through that cord. And so what happens is that cord pH level, that cord oxygen levels, drops really drastically in a really short space of time, which is why there's a half an hour limit on a Category 1 caesarean birth. In relation to the anaesthetic use for Category 1, it can either be a general anaesthetic if there's very limited time and they need to get anaesthesia in very quickly. Sometimes it can be a one-shot, very quick spinal, or it can alternatively be an epidural top-up if an epidural has previously been working really well. Category 1s are the least common category of caesarean birth here in the UK. Category 2 caesarean births are the most common category of unplanned caesarean births. Common reasons for a Category 2 caesarean birth include potential sepsis, for example, concerns with the baby's heart rate, maybe there's been a delay or stall during that labour and birth process. Having a Category 2 provides time to be able to get good, adequate anaesthesia on board, like a spinal or epidural top-up. It also means that it's not as scary and as much of a Holby City dramatic moment as what a Category 1 can be. And it means that it becomes a more positive experience because a lot more of the choices that the person wants as part of their labour and birth process can happen and can be supported and facilitated because there's a longer time. And sometimes you could go in for a Category 1, but actually that baby's heart rate has recovered, maybe the bleeding has subsided, that you can step it down to a Category 2 and just provide a little bit more information, a little bit more discussion, actually support the woman in a more positive time frame as well, but that's only if suddenly the situation becomes better and less risky. Category 3 are unplanned caesarean births, so they weren't intended caesarean births, but they became apparent. For example, it might be that someone's had an induction of labour process started, but their cervix hasn't opened enough to be able to break their waters. That would be a Category 3 because they didn't come in for a planned caesarean birth. They went in for an induction of labour, but the plan changed when the induction of labour did not work. Category 3s are also for women who have planned a caesarean birth but maybe gone into labour or their waters have gone before their planned caesarean birth date. They are ideally same day caesarean births, so ideally within sort of a 12 to 24 hour period, but they do not come above a Category 1 or 2 caesarean birth from a safety perspective of managing the units. What it does is it provides the option of safety for women from an anaesthetic point of view, particularly if they've eaten recently, so they can give a little bit more time before they need to go for a caesarean birth. But it also means that they don't jump above a 2 or a 1, for example. Sometimes Category 3 caesarean births go in straight away if there's nobody in theatre, if they haven't eaten recently, for example, if it's safe to be able to provide that caesarean birth. Sometimes Category 3s actually happen relatively quickly. In Category 4 caesarean births are the most common category here in the UK. They are planned caesarean births. For example, placenta previa, where that placenta is covering the cervix. Could be for a breech baby, could be for maternal choice, for example, could be for twins. It could be for almost anything like reduced growth, reduced lical volume, absent EDF, absent Dopplers on scans, for example. There are lots of reasons why caesarean births can be a Category 4. They can sometimes be delayed and put off for another day, and they certainly don't come above any of the other categories of caesarean birth. Lots of areas have planned caesarean birth lists so that they are separate to the unplanned lists. And what it does is it means that women know about their caesarean birth ahead of time, have pre-operative clinics, have pre-operative counselling, have plenty of time to be able to go through their choices, their options, and what a caesarean birth entails.